What if I told you that autism diagnoses today are far more common than they were just a few decades ago? In the United States, about 1 in 36 children is diagnosed with Autism Spectrum Disorder. That number surprises many people. Some ask, is autism really increasing? Or are we just getting better at identifying it? Science suggests it is a combination of both. And new research is changing how we understand autism. Autism is not one simple condition. It is a complex spectrum of differences in brain development and behavior. Today, we will explore why autism cases are rising, new discoveries about autism subtypes, what happens inside the autistic brain, how genetics and family history play a role, and what modern science says about treatment. So stay with me, because this information could change how you think about autism forever. Introduction to autism. Autism, medically known as Autism Spectrum Disorder, is a developmental condition that affects how a person communicates, interacts socially, and processes information. It is called a spectrum because symptoms vary widely. Some individuals need significant daily support. Others live independently and excel in specialized skills. Autism mainly affects 3 areas. 1. Social interaction. People with autism may have difficulty understanding facial expressions, maintaining eye contact, making friends, understanding social rules. 2. Communication. Some children may speak late, repeat words, use limited gestures, struggle with conversation. 3. Repetitive behavior. Many children show behaviors like hand flapping, rocking, repeating routines, intense interest in specific objects. These symptoms usually appear before age 3. But autism is called a spectrum because symptoms vary greatly. Some individuals need lifelong support. Others become highly successful scientists, engineers, or artists. Importantly, autism is not caused by one single factor. It is influenced by genetics, brain development, and environmental interactions. And modern research is revealing that autism itself may not be one disorder. Let me share a brief story. A family noticed their child rarely responded when called by name. The child preferred playing alone, and communication developed more slowly than expected. After medical evaluation, they received a diagnosis of autism. For the family, it was both surprising and emotional. But diagnosis also opened doors to therapy and support. Early intervention can make a major difference. Children who receive support during developmental years often improve communication and social skills. Autism does not define a person's potential. Many autistic individuals go on to lead successful, meaningful lives. The key is understanding and support. The autism explosion. Why cases are rising worldwide. Let's talk about something that has puzzled scientists, parents, and doctors for years. Autism diagnoses are rising dramatically. In the early 1990s, autism was considered rare. At that time, only about 1 in 2,500 children were diagnosed with autism. But today, the numbers look very different. Recent surveillance data from the Centers for Disease Control and Prevention show that about 1 in 36 children in the United States is now diagnosed with Autism Spectrum Disorder. That means autism is now one of the most common developmental conditions in the world. So what is happening? Is autism truly becoming more common? Or are we simply getting better at recognizing it? The answer is probably a combination of both. Better awareness is. One of the biggest reasons for the increase is awareness. 30 years ago, many children with autism were simply labeled as shy, intellectually disabled, socially awkward. Parents and teachers didn't recognize autism. Today, doctors, teachers, and parents are far more aware of the early signs. Because of this, children are diagnosed much earlier and more frequently. Autism diagnoses have increased dramatically over the past few decades. Years ago, autism was considered rare. Today, it is one of the most commonly diagnosed developmental conditions. Why? Science points to several reasons. 1. Better awareness. 30 years ago, many autistic children were labeled as simply shy or socially different. Doctors and educators did not always recognize the signs. Today, Awareness is far greater. Parents and professionals understand early developmental differences. This leads to more diagnoses. 2. Improved screening. Many countries now screen children during routine health visits. Early screening helps detect developmental differences sooner. In the past, some children were not diagnosed until school age. Now, diagnosis often happens earlier. Early detection allows therapy to begin sooner. 3. Changes in diagnostic definitions. Diagnostic guidelines evolved over time. Conditions that were once separate diagnoses were combined under the umbrella of Autism Spectrum Disorder. This change increased reported numbers. It does not mean autism suddenly appeared. It means diagnostic understanding improved. 4. Environmental and genetic research. Scientists are studying possible environmental influences, such as pregnancy factors, parental age, developmental influences, but research emphasizes that no single environmental factor causes autism. Autism likely results from complex interactions between genetics and development. 5. Global trend. Rising diagnosis rates are observed in multiple regions. North America, Europe, Asia, Australia. This suggests a worldwide pattern linked to awareness and diagnostic practices. 6. What it does not mean. Increased diagnoses do not necessarily mean more children are developing autism. It may mean we are finally identifying individuals who were previously undiagnosed. Understanding this distinction is important. Autism is not one disorder. Modern research reveals a groundbreaking insight. Autism may represent multiple related conditions rather than a single disorder. Large genetic studies show significant biological diversity among autistic individuals. Some people diagnosed early in childhood have different genetic and developmental patterns than those diagnosed later. This means autism exists on a spectrum of biological variations. Science is still working to understand these variations. But one thing is clear. Autism is complex. There is no single explanation. 4 different autism subtypes are. Recent studies analyzing thousands of cases identified 4 major autism subtypes. 1. Social and behavioral challenges. This is the largest group. Individuals often experience social communication difficulties, repetitive behaviors, anxiety or attention challenges. Developmental milestones may appear typical in early childhood, but social differences become more noticeable later. 2. Autism with developmental delay. Children in this group may experience delayed speech, motor development differences, learning challenges. However, they may have fewer psychiatric symptoms. Support and therapy can significantly improve developmental progress. 3. Moderate challenges. This subtype includes individuals with milder symptoms, normal early development, varying social differences. Many in this group live independently as adults. 4. Broadly affected. This is the smallest but most severe group. Challenges may include significant developmental delays, language difficulties, higher support needs. Early therapy is especially important for this subtype. Why subtypes matter. Understanding subtypes could help doctors personalize treatment, predict developmental outcomes, provide targeted support. This represents the future of precision medicine in autism care. The strong sibling link. Research also highlights a genetic connection. Children with an autistic sibling have a higher likelihood of autism compared to the general population, studies suggest. Around 20% risk for siblings. Higher risk in families with multiple cases. This does not guarantee autism in siblings, but it indicates genetic influence. Genetics plays a major role in brain development. However, environment and individual variation also matter. Inside the autistic brain is. Let's explore neuroscience. The brain of an autistic individual processes information differently. Research using brain imaging reveals differences in connectivity, variations in neural communication, unique patterns of information processing. The brain contains billions of neurons communicating through synapses. In autism, these communication patterns may differ. Some regions may be overconnected. Others may process information in unique ways. This helps explain. Sensory sensitivity. Social differences. Strong attention to detail. It does not mean the brain is damaged. It means the brain develops differently. Sensory processing differences. Many autistic individuals experience heightened sensory perception. Sounds, lights, or textures that seem normal to others may feel overwhelming. This is why some people prefer quiet environments. Avoid certain textures. Use sensory coping strategies. Understanding these differences fosters empathy and support. Strengths of autism are: autism is not only about challenges. Many autistic individuals excel in areas such as pattern recognition, deep focus, specialized skills, creativity. Diversity in thinking benefits society. Different brains contribute different strengths. What really causes autism? Autism is not caused by one single factor. Scientists believe it results from a combination of genetics and environment. 1. Genetics. Genetics plays a huge role. Research suggests hundreds of genes may be involved in autism. Some of these genes affect brain development, neuron communication, synapse formation. Scientists estimate autism is highly heritable, meaning it often runs in families. 2. Brain development. Studies show differences in brain connectivity, neuron signaling, excitation-inhibition balance in the brain. These differences may affect how information is processed. 3. Environmental factors. Researchers are studying possible influences such as parental age, pregnancy complications, maternal illness, exposure to pollutants. But these factors do not act alone. They interact with genetics. How do doctors diagnose autism? Autism diagnosis is based on behavior and development, not a blood test. Doctors look for 2 main features. 1 is difficulty with social communication. 2 is repetitive behaviors and restricted interests. These criteria come from the DSM-5 diagnostic manual used worldwide. Diagnostic process usually involves developmental screening, behavioral assessment, psychological evaluation, speech and language testing. Specialists involved may include pediatricians, child psychiatrists, neurologists, psychologists. Early diagnosis is extremely important because early intervention can dramatically improve outcomes. There is no blood test for autism. Diagnosis helps families access support services. Early intervention can improve outcomes. Early warning signs are: parents should watch for early signs such as no babbling by 12 months, no pointing or gestures, no words by 16 months, loss of language skills, lack of eye contact. If parents notice these signs, they should consult a doctor. Early therapy can change a child's future. Treatment and management. There is no cure for autism, but there are many therapies that improve quality of life. The most effective treatments include 1. Behavioral therapy. The gold standard is applied behavior analysis. This therapy helps children develop communication, improve social skills, reduce problematic behaviors. Behavioral interventions are considered first-line treatment. 2. Speech therapy. Many autistic children have speech delays. Speech therapy helps them develop language, understand communication, improve social interaction. 3. Occupational therapy. It helps children learn daily activities, sensory regulation, motor skills. 4. Medications. There is no medication that cures autism, but doctors sometimes treat associated conditions like anxiety, aggression, ADHD, sleep problems. New technology in autism diagnosis is: the future of autism diagnosis may include artificial intelligence. Scientists are developing AI tools that analyze eye movements, facial expressions, speech patterns. Some experimental models have achieved over 95% accuracy in identifying autism patterns in research settings. This could allow earlier screening in the future, even in remote areas. The new autism science controversy is: recently something unusual happened in autism research. A group of leading scientists announced the formation of a new independent autism committee. Why? Because they were concerned that political influence could spread misinformation about autism causes, especially the false vaccine link. The new committee includes former research leaders, autism scientists, public health experts. Their goal is to ensure that autism policies remain based on scientific evidence. They also plan to publish independent research reports and guide future autism studies. This shows how seriously scientists take the issue of misinformation. Living with autism. Autism is not just a diagnosis, it is a lifelong experience. Some autistic individuals have extraordinary abilities. Many famous people are believed to have been on the spectrum, including brilliant scientists, artists, and innovators. But autism also brings challenges. Families often need therapy services, educational support, community understanding. Society must shift from simply treating autism to supporting autistic individuals. The future of autism research. Scientists are now exploring exciting new areas. In genetics, understanding which genes contribute to autism. Brain imaging, mapping how autistic brains process information. Artificial intelligence, using machine learning to detect autism earlier. Personalized treatment, tailoring therapy to each individual child. Researchers now believe autism is not one condition, but many related conditions with different causes. This understanding may revolutionize treatment in the coming decades. A message to parents. If you are a parent watching this video, remember 3 things. 1. Autism is not your fault. 2. Early help makes a huge difference. 3. Many autistic individuals live happy, successful lives. With the right support, children with autism can thrive. New scientific developments. Autism research continues to evolve. Scientists are studying genetic variations, brain imaging, personalized therapies. Recently, independent research groups formed to ensure scientific integrity and evidence-based understanding. This reflects the importance of rigorous science in public health. Autism is complex. It is not one disorder. It exists on a spectrum of differences in brain development and behavior. Science continues learning. Understanding grows every year. The goal is support, not judgment. With knowledge and empathy, society can help autistic individuals thrive. If you found this video informative, like, comment your questions, subscribe for science-based content. Knowledge reduces misunderstanding, and understanding creates a better world.